Good afternoon. Welcome to the Rotary Club of Jonesboro. For 5 consecutive years, the reigning club of the year. Now our inspirational moment from Marie Curie. She's the only person to win the Nobel Prizes in 2 separate sciences, physics and chemistry. Nothing in life is to be feared. It is only to be understood more so that we may fear less. Okay, now for our program, we'd like to welcome Kyle Lomax, CEO and pharmacist with Southern Pharmacy. And I don't have a bio, so I think everybody knows you. And so you can fill it in, okay? Thank you so much for being here today, Kyle.
So a little bit about me, 2nd generation pharmacist. My father grew up in Monette, and so my wife is also a pharmacist. So I'm here today with my student, Casey Max. She's also from the area. She's a colleague of mine, be graduating within the next probably year with a degree in to be a pharmacist. And so we're happy to have her this month doing some rotations through our pharmacies here in Jonesboro. So the reason I'm here today is to kind of give you an overview of COVID-19 vaccinations and how you can help your community in promoting vaccination. So we have had a very active 6 months to get to where we are today. But as we get into the presentation, hopefully you'll see how you can help. You guys are influencers, whether you know it or not, inside this room, in your community, in your place of worship, your next door neighbor. You guys can influence vaccination for our population. And so your community needs your help. So I'm hopefully going to give you information on how to pass that along to someone that may have hesitation about the vaccine. And just some things that maybe there's some misconceptions on out there in the public about vaccinations up to this point. So this was presentations put by the Arkansas Department of Health. So everyone has probably experienced somebody that has been affected by COVID-19. I did not see any group that was isolated from infection. So that's important to realize that we still have that likelihood of the unvaccinated population. So a lot of the places that have increased risk are where you're having large groups. So factories, restaurants, schools, healthcare facilities. Also, people of color are at higher risk, African Americans, Hispanics, Marshallese. That particular population does have an increased risk of complications due to COVID-19 infections. So vaccinating that population is very critical. There is no yes or no, it's a maybe on how COVID-19 will affect you. We've seen a broad spectrum of individuals that were infected with COVID-19. Some had mild to asymptomatic. Some people had very severe cases, hospitalization, and also deaths. So vaccination in all populations can hopefully reduce that. And hopefully, as I get into it and explain a little bit more about the vaccines themselves, you'll understand why it's important that we can continue to vaccinate our communities. So like we were talking about, the persons of color are also more likely to have complications due to COVID-19 infections. Your older populations, which are the 65 plus, certain conditions, which could be diabetes, chronic COPD, heart conditions will have an increased risk of complications, and then smoking. And that's because the initial COVID-19 does a lot of damage to the cellular makeup of the lungs, and it causes complications. So smoking is just an added risk to anyone that falls in that category. So like we talked about, you can you can, if you're not unvaccinated, you may be asymptomatic and give it to another individual that is unvaccinated. So it's very important that you and or your neighbor promote the spread or promote vaccination to decrease the spread of COVID-19 to other individuals. The vaccine is the best way to protect yourself. So as we get into some of this information that was, as some of these later slides, you'll see how as we vaccinated our community, the rate of COVID-19's infection have just fallen off according to the increase in number of people that who are vaccinated. So this is, everybody's seen this picture. This is probably the most prominent selfie of 2020. So this is the SARS-CoV-2 virus, and everybody probably refers to it by its nickname, the coronavirus, but really the reason it's called the coronavirus is due to the spikes. And those little red spikes are very important when we talk about vaccination. A lot of our vaccines use that as a target to promote immunity within our body. So when we talk about how the vaccine works, there are two mechanisms the way this vaccine works, or two deliveries, but really the end point of creating immunity is all around that spike protein. So the mRNA vaccines, which are Pfizer and Moderna, they take a small piece of genetic code and it gets inserted into your cell. Now, when you think about that, we are not inserting that genetic code into the nucleus. So there's this misconception that it does interact with our DNA. To interact with our DNA, you have to get inside the nucleus. So these vaccines do not enter the nucleus. They do not interact with our DNA. That's important. That's a misconception that we need to be educating our communities on. So how they work is, so the mRNAs, Pfizer, Moderna, they take that small piece of genetic code, they insert it into our cells. Our cells take that and they start making little bitty spike proteins, or those little bitty red spikes on the cell itself. They make those, and then they get put out they get pushed outside the cell, and our body sees those as a invader, or they see them as something that they need to identify and learn. So they start making antibodies, and this learning process is really what we want to promote immunity inside our system. So, so the two mRNAs, Moderna and Pfizer, use that mode. Then the Johnson & Johnson uses a different mode, but it gets to the same place. They take what's called an adenovirus, which it is a virus that is, best way to explain it, it doesn't have a lot of, it doesn't cause illness in the body, but it can take that genetic code, put it inside our cells, and then we start making those spike proteins. So both the Johnson & Johnson and the mRNA vaccines, Pfizer and Moderna, use the spike protein to promote immunity inside our system. So when we talk about the trials, this is how they are designed. So there's probably been no time in our history when you can go outside and get somebody in a trial overnight. So when you talk about speed of how this vaccine was developed, there's a couple of things that I always point to when patients ask. I'm concerned about how fast this came to market. So we can walk outside our door and get thousands of people in a study overnight. One thing is, I think it was the rallying of our scientific community to get behind a joint effort of coming up with not only one mechanism, but multiple mechanisms to come up with a vaccine. And then, there was also this great amount of money that was put into the development. For the virus itself, it has been on our side, even though it's causing all this deaths. From a vaccine production or vaccine development side, it's been kind to us, meaning that spike protein has stayed fairly stable. We've not had a lot of mutations up till probably the last 3 or 4 months, but we did not mutate beyond the scope of the vaccine. Now, as we start seeing in some of these slides later down the road, we are starting to see variants that are showing their head in surrounding areas and in Arkansas that may be something that we have to start looking into a little bit closer when we talk about vaccination. So this is how they were designed. So obviously you can see that in the study, half of them got the COVID-19 vaccine, half of them got a placebo or basically didn't get anything at all. And only 8 people who got the vaccine ended up getting COVID-19, and then 162 who got the placebo got the COVID-19. That's how these studies were designed. It's obviously a lot more technical than that, but when we're talking to somebody that maybe does not have the medical terminology, it's better to have some easy to understand points of talking points to kind of guide them through their hesitation. There were no steps that were missed in the development of this vaccine. They still went through the same steps. They were just an accelerated beyond the normal process. We talked about the number of dollars that were put into this. And like I said, our scientific community had this, had the virus mapped, its DNA mapped early on in the process. We probably had a pathway to vaccinations probably within 48 to 72 hours after we had a genetic makeup of this virus identified. So, the scientists you probably will never understand how lucky we were to get a vaccine pathway that quickly. So all those factors together really answer the question about speed of development. So the clinical trials involved, depending on the vaccine, all the trials had the African Americans, Hispanics, Native Americans, Asians as part of that. And when you talk about age groups, there are, especially early on, most of them were age 18 to 91. Pfizer did in their initial application go down to 16, which was important as we got into that age group. We had a vaccine to start going down to that to 16 years of age. So some things that people are saying about the vaccine. I hear a lot of things as I'm vaccinated in public. One thing I heard last week is I'm not going to get the vaccine because it causes back pain. Well, I've not seen anything in the literature with that, but there's a lot of anecdotal facts that are being passed around to our community that have that may not even be associated with the vaccine at all. There are side effects, and basically they're due to the immune response in your body. So those could be headache, fever, chills, fatigue that you're probably going to experience with most vaccines. The flu vaccine is probably going to give you the same type of response, and that's because it is an immune response. So there are a lot of things floating around in our social media and around our community that are not based on fact. So should I get the COVID-19 vaccine? This slide was really developed before we had the push down to 12 years old. So basically anybody at this point that's 12 years of age or older can be vaccinated. I had someone send me a message over the weekend. Their child was 13 and asked me what my thoughts were. My thoughts were get them vaccinated as soon as possible, especially before they go back into school. They'll be protected by then. And there's going to be a situation where we're going to see an uptick back in the fall because we have a large portion of our population that's not vaccinated. And you also, even if you've had COVID-19, you still should get vaccinated. We do not know at this time how long immunity lasts, especially in the natural immunity of meaning you've had COVID and produced your own antibodies. That's still a topic that they're researching, but if you've had COVID-19, you should still get vaccinated. Pregnant, we have had a few people that are pregnant to get vaccinated, and that's something that they need to speak with their prescriber about to figure out if that's the best case. for them. But we have had vaccinated some people that were pregnant and breastfeeding. So when to get vaccinated? Most healthcare facilities are probably doing walk-ins. So you could probably walk into any pharmacy, any clinic, and probably get vaccinated today if you want to. So when you talk about the vaccines themselves, so Pfizer is the mRNA vaccine. It's your 2-dose vaccination. It requires 1 dose and then a second dose within 21 days. You do have a window about the 6 weeks after your dose if you happen to not fall within that 21 days, or so your window is 3 to 6 weeks after Pfizer. The Moderna is another mRNA vaccine. It's a second dose 4 weeks after the first dose. So 28 days, and then you can go out to 6 weeks on your second dose if you need to. Johnson & Johnson, a little bit about Johnson & Johnson. April 13th is when they put the pause on for Johnson & Johnson. That was due to a rare occurrence of blood clots. And that was mostly isolated to women less than 50 years of age. There was a 10-day pause put on it. After on April 23rd, the CDC, in combination with the Advisory Committee for Immunizations, recommended that we continue forward with Johnson & Johnson. But if we do have somebody we're vaccinating that would fall into a high-risk category, or a category of concern would be the women less than 50, so we do advise them. It is a single shot. We did see a lot of want in that category, but after the pause, we've seen that kind of fall off. We're starting to see more people wanting to go with the single dose, especially if you go into a factory, they want to get it done and not have to come back for a second dose. So Johnson & Johnson is something that we're starting to see more people want after they kind of got this. We've been through the pause, and they're saying that there's the incidence of blood clots. There's 28 cases, and we almost given 9 million doses of Johnson & Johnson. So it's very low, but we do counsel on it before we give it. One thing that is not known to some people in the community is that this costs zero. This is paid for by taxpayer dollars. So there is a small group of people, I think it's around 7% that they polled, says that they're not going to get the vaccine because they're concerned with cost. Will not cost you anything to receive the vaccine. So if that's something that you run into, cost is zero for anybody that gets vaccinated. So side effects, sore arm, that's the most common. Usually it's the next day. Just feels like somebody just gave you a good whack in the arm, and it could be sore for anywhere from 24 to 72 hours, but most of the time it goes away within that. You can have the headache, fever, chills, fatigue, muscle weakness. Like I said, that's just an immune response. And but that's also what we're looking for. We're looking for our body to recognize the vaccine and do its duty by producing the antibodies. So I just want to dive in. I know there's a lot of charts, but I just want to dive into some numbers on where we're at. I don't know if anybody follows this, but this is the health department puts this out every day. So you can see the number of cases, the number of, the number of total cases. Now, something interesting that happened on Friday, we've been hovering around between 100 and 200 new cases a day. But on Friday, that jumped up to about 393. And there's a couple of reasons why that is. There could be this increased incidence of variants in our community. So a variant is basically that spike protein, its genetic code is changing. And basically this natural selection process is taking over. And these viruses are becoming aware, I don't know if that's a great word, but they are changing their genetic makeup based on the environment that's presented to them. And so we're starting to see these variants. And so you've probably heard of the UK, the Brazilian, there's a California strain. These have changed their genetic makeup to be some of them have a greater affinity to latching onto our cells. So that means that they are a lot easier spread, or they cause more symptoms, or they affect people that maybe would have been asymptomatic if they were infected with another strain. So that was something that jumped up on Friday that was surprising compared to the last several weeks. There's our doses of number of vaccinations that we've given up to this point. This is the metrics for Cricket County. So you can see the number of total cases that we've had in 13,000 total cases. So our first case was in March 1st of 2020. So that is a running total since then. This is vaccination. So this is where we start talking about hesitancy and how it's affecting our community. And the darker blue are obviously areas of that have higher rates of vaccination. So you can see there that Cricket County is not really, it's in a darker blue shade, but it's not one of the darker blues like up in Clay County and then in central, and then as you get up in the northwest part of the state, and that's Benton and Washington County, so that's a favorable area. Interesting, just there was a more of a want of vaccine in Northwest Arkansas than Northeast, meaning that they were always in need. When it was in short supply, they would always take vaccine if they could get their hands on it. So that's why there's just an increase of a vaccination in that area. A lot more want. There's the Craighead County, so you can see 30% fully immunized. You can't see it right there, but we've number of doses administered is 63,000. So based on the health department's current census, we've only vaccinated about 30% of our population in Craighead County. This is where you say, does vaccines work? This is a great example of where vaccines work. So it starts February 1st. So the first vaccines were around the 14th of December. So you can see as we started vaccinating, the number of cases has fell off according to our vaccination rates. This is a rolling average. This is really what the health department looks at for their caseload. As you can see, January would be the most number of cases, and then as we started vaccinating, population fell off. That little blip there in March was just the data dump that they had that threw the numbers off. We did not have that many cases on that day. This is the number of positive cases by county. Anything in blue would be considered high. So obviously there's areas in Craighead County, Craighead, Mississippi that were high. Crittenden County had a lot, probably associated with our proximity to Memphis. You know, they were hard hit, so maybe some commuters added to that population over there. There's another line that correlates our vaccines working. Number of hospitalizations, as we see February timeframe, and as we vaccinate the public, they're falling off. By group, just another chart. The thing that is really, when you start talking about variants, as you can see here, February, and then as we're on to March, this gray section, they're making up a larger proportion of that number. And that is our population that is in the 49 to 64, and then also the 25 to 48. So that is where we see the most hesitancy, and that is where we're seeing the most number of cases. So that is directly correlating with the hesitancy that's in those groups. Just to give you a timeline on how the vaccinations start, phase 1A was in mid-December, so that would have been healthcare workers, essential. 1B would be your, that's when we really went into the 65 group. So we worked on that group almost through the first week of, or the mid-March. 1C, you're going to bring into, or The remaining phase of 1B would have been your essential workers that we didn't pick up in phase 1. 1C is when you're going to get into people with chronic conditions. And then we went to 16. And then recently we went to 12 to 15. So when we went to 16, the only vaccine that we have will go down to that age is Pfizer. So, and then they went down to 12 to 15. Moderna has submitted their approval that will hopefully happen sometime next month. We'll be able to go down to 12 again too. So anybody younger than 16, right now, their only option is Pfizer. Number of first doses. The snowstorm really did a job for us here. We were going pretty good, snowstorm. Then it hit, we fell off. So we probably didn't vaccinate anything for a week. So we had a big spike. But as you can remember, the number of hospitalizations and the number of cases are directly correlating with our number of vaccines. So at the peak of the number of vaccines was probably the lowest point when we've had the number of cases. When you start talking about ages, this is where we were looking at those, the proportion, the number of the 34, 30, and 29 year of age. So the 55 and older is the top line. So they've been vaccinated early on. They've had a lot longer opportunity. But this 35 or 25 to really 45 group is where we're seeing the most hesitancy. So, that's where we're really bringing down our average. We've got over 50% of our 55 and older, but these are hovering around the 25 or less. Males, the females are definitely taking over as far as the number of people vaccinated. I will say this, males are more scared of needles than females. I don't know why, but they are. But that seems to be the case that they just don't like needles. So we are seeing a little bit of decline in males versus females in the number of males. This looks at the 65 plus. One thing I will say about Arkansas, we are probably at the top or leading the nation in identifying populations that ethnic populations based on race. And so we've been really good about making sure that we're not overlooking that population, especially because they have higher incidence of complications to that. So we've been really good at that. This is looking at 12, same chart that down to 12. So we're doing really well in making sure that we're picking up those groups. Really, that's an overview of where we've been. I'm challenging this group and other groups to be an advocate for vaccines, especially not only COVID vaccines, but all vaccines. They are, I hope you can see with the information that we presented here that vaccines are working. COVID vaccines are working. As we increase our number of vaccinations, the number of hospitalizations and the number of cases are declining in step with that. So be an advocate. If you have questions or you need assistance, talk to your doctor, talk to your pharmacist, talk to your healthcare professional, get the answers to educate your colleagues, your neighbors, your places of worship, and just make sure that we don't go back to a time when we're talking about this high number of incidents and high number of deaths like we were early this year. So based on the numbers, there's probably people in this room that have not been vaccinated. I did bring vaccine here today. If anybody would like to be vaccinated, myself and Casey will make sure that you don't get out of here without a vaccine. Here's something I will say. I'll sum this up. I am not, if you choose not to get a vaccine, I support that because that's your decision. But do not make a decision based on information that's not factual. Everybody has a choice, and I completely support that. But we want to make sure you make the right choice based on the information. So with that, I will close, and I will be here, or if you have questions, I will answer them. over here. Yeah. Yes. So there is a meeting on the 18th. There's the advisory committee to the CDC. It's called ACIP. They meet anytime the CDC and or the FDA makes an approval, they meet and they make clinical recommendations for whatever group that the vaccine was studied for. So there is an emergency meeting on the 18th, which I think is Friday. There's not been an agenda published yet, but there has been talk with inside of some pediatric groups about taking that down to the 6 years of age. I don't know if that is on their agenda, but I would suspect that we're going to see this probably before the school year.
Are these vaccines supposed to be annual vaccines as the flu shots are annual?
So I think the jury's still out. If there's one thing that we're seeing, our immunity is not waning, meaning that over time, we're still seeing a sufficient level of immunity to support us not being vaccinated. Now, obviously, we've only been really vaccinating on a huge scale for 6 months. So there's this continuous review of the data. So there's been talk. There's been talk by the CEOs of the manufacturers of the vaccine. I think one thing that we have to be concerned about is the variants. If we cannot outrun the variants, meaning that if we can't get enough people vaccinated to prevent spread and those variants become prominent in our communities, it may be that we find that these vaccines are not that we'll have to do a booster that is modified to target those particular variants that are becoming more prominent. So, I've heard September timeline, but I would think that there's really nobody that knows exactly when we're talking about boosters if we have to have them. So they have reclassified all those strains based on, so to make it easier for the scientific community, there's alpha, beta, gamma, delta. And I did have a slide in here that was talking about variants. I think I took it out because it was maybe a little bit too technical. But we are seeing so there's variants in Craighead County, and I forgot which one is most prominent. I have to look back on it, but it's not a huge number. But there are a few variants that have been sequenced in Craighead County. And so if you look at that map, Pulaski up in northwest Benton and Washington County, you're seeing variants that are coming, usually in some of the larger populations. That's of concern. It's what they classify as a variant of concern. What makes people higher risk? The African American population usually has a higher incidence of several chronic diseases. When you look at, let's take, for instance, you're 65 plus. The reason they're at high risk is as we get older, our immune system gets a little tired and it doesn't want to work as well. Those particular populations seem to have more of first of all, a hesitancy in getting immunized. That's been a problem. And then also, we do see that there is just a higher incidence of complications due to just the case studies that we've seen since, March of last year, February, March of last year. We're just seeing that affects, COVID-19 affects that population more.
Sorry, I'm listening to you on Zoom, so
Okay.
echo. First of all, thank you to you and all pharmacists across this country for doing the hard work of putting shots in arms. So for that, thank you very much.
Thank you.
I think you're speaking to speaking to the choir. I know a lot of us are vaccinated. What's the biggest hesitancy that you see, and what can we say to them to convince them to get vaccinated?
The biggest hesitancy I see is based on, there's a slide in here and I didn't put it in here, but they've changed. The CDC has put on their package insert that these vaccines don't contain egg. I think there's, some of your flu-based vaccines are egg-based. And so, that's been a topic that's been out there. I think the biggest one that I've seen, and I'm not a social media guy, but like this magnetism thing. So the CDC has had to come back and revise their advisory committee came back and said, there's no nanowires, there's no metal, there's no, so we're combating these topics that the CDC is having to come back and really reaffirm in some of their literature and some of the package inserts that they're just not there. You know, I've given a lot and I've looked inside a bottle. I don't see any metal or wires in there. So I think that's the biggest thing, is just the social aspect surrounding vaccination. And that takes, I've always thought that the vaccinating would be hardest when we got to this point, because we've got people vaccinated that wanted to get vaccinated. It's going after the ones that don't. I've not seen that. No, I would not think that if it wouldn't be due to the vaccine. Now, if it was due to something else, you may want to get checked out. So. Or maybe it's just a magnetic personality. Who knows? You know, there you go. Well, I appreciate the opportunity. I'm here. I have vaccine if anybody needs it. And if you know anybody else that wants to get vaccinated, all the healthcare providers in the area can probably facilitate that in a very short period of time. So I appreciate Rotary and you guys giving me the opportunity to make you aware of where we're at with COVID-19 vaccination. All right, thank you. Appreciate it.
Kyle, thank you so much. It's very informative. Appreciate you taking the time to come. And our thought for the day is from Alexander Fleming. He's a Scottish doctor and microbiologist who discovered penicillin. The unprepared mind cannot see the outstretched hand of opportunity. Okay, we're adjourned. Thank you.